thank you so much for being with us for another edition of Austin Fit Talks. I'm really excited about the conversation we're going to have today because I think it's something different than what we presented in our previous episodes. I'm joined by Dr. Song and Dr. Luo, who are both with AOMA here in Austin, which is a school of integrative medicine. So I want to start, if we could, by having each of you just give us a little bit of background on what you do so people have somewhat of an understanding. Dr. Luo, if we could start with you, that would be great.
I work for AOMA almost 13 years. Before that, I worked in China, one hospital, state hospital, and as a physician. And also we give Chinese herbal, acupuncture, and together. Right now, AOMA primarily teaching students and service patients, and also supervise clinic. And also, because right now we have a pandemic condition, actually very close to my specialty. I just graduated from the Johns Hopkins Bloomberg Public School. So we have some responsibility to use some herbal or acupuncture to help people in this very hard time.
And Dr. Song, that might lead us perfectly into what you do, because I believe you specialize to some extent in herbal treatments, correct?
Yes, that's correct. I joined AOMA in 2008, and my specialty is in Chinese herbal study. And so right now I'm the director of the herbal study department and also the director of the DAOM, the doctorate program at AOMA.
So when we talk about, I think, the situation we're in right now with the pandemic, obviously everybody is maybe more than usual so concerned about their health. How do each of your expertises and your specialties do you think apply to the moment we're in? I know, Dr. Luo, you said that there might be some application between what you do and the situation we find ourselves in right now.
Yeah, actually, I think it's right now the condition is pretty sad. Actually, in this whole country, a lot of people have confirmed the cases, and also many people are dying. More than almost 12,000 people have died in this country. So actually, acupuncture and especially the herbal, we could help a lot in this stage. But unfortunately, there is no very well-organized and national-wide evidence-based research on herbal to address this condition. But actually, in many other countries, Oriental medicine, herbal has been widely used. Acupuncture also has been widely used in clinic to address this, because acupuncture could help strengthen the people's defensive or immune condition. That's very important in this condition, actually. Yeah, we hope we have a chance to let more people benefit from acupuncture and herbal in this condition. Yeah, to save people's life. Yeah.
It's so important, obviously. Dr. Song, what are your thoughts on that?
Yeah, definitely that one part we are talking about that we would like to help in this critical condition. And at the same time that herbal can be a good choice is that to keep your body balanced and to avoid it to getting symptoms or sickness from, doesn't matter it's COVID or stress or different kind of issues related. And so a lot of times we say that how to keep yourself healthy, definitely important thing, 4 aspects. How's your sleep? How's your mood? How's your appetite, your diet? And how about movement? So if we are able to support from the part that maintain our body balanced in a healthy condition, that would be the part that we can avoid it, fall into sickness or fall into having symptoms suffered from infectious diseases. So that would be the part that Chinese medicine, herbal medicine, acupuncture be able to help. So like right now that we are not fully opened in many businesses. So that's why AOMA, we are doing telehealth. And this is the one that going through virtually, that we are getting all the symptoms. How's your stress? How's your sleep? And how's every details. Then we're going to do an analyze and then see what would be the individual specialized herbal prescription we can provide to keep people stay healthy, stay balanced.
Are you seeing results from people right now who are coming to you and seeking treatment?
Yes. So we're not necessarily say that we're treating COVID, because that's not our specialized for treating these pandemic-related issues, but we are helping people. For example, a lot of stress has been stirred up recently, and also insomnia, and also sometimes that people having immune compromised situations such as like their blood sugar issues, and we are be able to using herbal treatment to be able to managing them and managing all the numbers, and also help them be able to stay in a more immune supported situation and reduce the risks to getting infectious diseases.
I think our audience here at Austin Fit Magazine is generally people who are active and at least to some degree typically healthy. But I'm curious, Dr. Luo, what do you tell people that maybe they've heard of acupuncture, they've heard of herbal medicine, but it just seems like such a foreign concept? How do you introduce it to people and allow people to begin to explore it and how it could potentially help them?
Yeah, this is a very good question. Yeah, a very good question, Ricky. Actually, right now, acupuncture primarily helps strengthen the Wei Qi, or you could say improve the immunity for the patients. Actually, what is immunity? Yeah, simply speaking, many people know the biomedicine, or right now immune system, including your skin, your lymph nodes, your spleen, thymus, or different organ. And also, has different response based on the immunity condition. Okay, for example, if any pathogens start attacking people, they are going to have a innate response, immune response, or has a adaptive. Yeah, innate just very, very initially, very fast response. Adaptive is more related to the T cell and B cell, to involve. But actually, in TCM, acupuncture, we're not so complicated. We could explain very easy. Yeah, we have some, we call the Wei Qi, definitive Qi. We have different types of Qi in the whole body, which circulated inside meridian, which including, for example, your chest, pectoral Qi, and your GI system, we call the Zhong Qi, just like in the middle part of the body. And also you have a Yuan Qi in the kidney, lower part of the body. So upper, middle, and lower. This is based on the location. And also we have another conception is based on the function. Some to nourish, some to help people defending. For example, the Wei Qi, just now mentioned. Right now, the coronavirus and the pandemic is very important to boost the defending Qi. But how to defend the Qi? How to address that? Several points. This is based on, the evidence-based alternative medicine. And published in 2015 in United States. You stimulate one of the points on the leg, which is around 2 inches below the kneecap. We call the stomach 36. Stomach 36. Or you could call the foot 3 miles below the kneecap. Actually, after stimulation, they could help immune system. They could help your intestinal mucosa immune system. For example, CD4 will increase. So that's actually, this also could benefit from other systems. For example, respiratory, right now the coronavirus. After stimulating points, they could help your immune system getting stronger. So you could try to defending yourself. And also, just like I say, Dr. Song mentioned some lifestyle change. Actually, all of this related to the TCM. For example, if the people has eating well, a more regular and balanced food, actually that will help. Just now mentioned the middle jaw, 中气. But if you want to let the patient right now, CDC start to advocate everybody has a social distancing. That's actually help to protect your clear qi. That's the pectoral, positive the upper part of the pectoral qi. So you could keep distance, make the patient not attacking you easily. At least to stay away 6 feet apart from other people. And also some other things, for example, exercise. They also could help your kidney qi. That is lower jaw yuan qi, the lower part of the body. Just now mentioned, So all the different lifestyle change actually could help. And also you could use acupuncture, or you could use some moxa to stimulate, for example, just now mentioned stomach 36 below the kneecap. That will help boost up your Wei Qi. That could prevent or make you have less chance to have an infection. by the coronavirus. And just now, Dr. Sung also said we didn't say we treated now coronavirus. Based on right now, many research internationally, okay, herbal do have some pretty effective function to inhibit some virus. Yeah, we didn't especially talking about coronavirus, but many different type of virus, they could be specifically handled by that. This theory is because, well, came from the worm disease theory in TCM history. Yeah, worm disease cover coronavirus, kind of bird flu, and SARS, anything they could handle. So in TCM, we could find some way, still in some points to help your immune system to prevent you from the disease. Thank you.
No, it's incredibly interesting. Dr. Sung, what about for you? How do you begin to explain to people how implementing this in your lifestyle can help you and you can see real benefits from it?
Yeah, just like I have mentioned that actually one of the important thing is balance. This balance is not one of the it is a type of dynamic balance. So which means that the balance is always changed accordingly. And when we talking about herbs, a lot of times people has been asking, do you have any magical herbs that we can take and using? So it's not to be able to say that at the beginning when the COVID started, there are some of the recommended herbs has been mentioned. So it sold out in our herbal store and in a very short period of time because people just said, I would like to get those. But the thing is that every individual has their very special, unique balance situation. And what would be the helpful ones that we definitely need to see what would be the best suitable for you. So for example, at the beginning, the recommended herbs contains like honeysuckle and also patchouli. And so when we are kind of like having people request about them, everybody said, I would like to take them. And then which caused the shortage of the medicinals, but it doesn't mean that it is the one that's suitable for everybody. The same thing nowadays, a lot of people wanted to getting support from the natural products. Everybody thinking about herbs is the natural state. That's the concept that people has been bringing in. For example, one of the very commonly recommended as a supplement as Astragalus. This is the one that people kind of using it as a good, we call it chi boosting, like energy support. And so sometimes people say, after taking it, I feel that I have more energy. And it can kind of like from 7 to 8 out of 10 and it ended up into 10 out of 10. But one thing is that if we look at individuals, sometimes the people who have blood pressure issues, hypertension, and this is the herb potentially may lift the blood pressure. So it can bring some of the side effects or risk factors. So that's why when we're talking about like herbal recommendations, I definitely say that it would be a good idea that we do a sit down, have a full analyze consultation, and to build the one that most suitable for each individual, and to bring back the balance of your body. This is the balance inside your body, also the balance between you and the nature. Between, virus is one of the things that the nature's creation, and human being has always kind of like searching for the balance between to survive in this nature environment. So herbal is just one part that give a little bit push to get the balance back. So that would be the part that usually like the herbal medicine would be helpful.
Sure. You mentioned energy and people reporting, the energy level feeling way higher, which for athletes, I would think in particular would be something they would be searching for. I'm curious, how do you see it applying to athletics? And do you see athletes turning to herbal treatments to help them?
Yes, actually both acupuncture and herbal treatment. And one thing is that we used to have like also booth support at the Spartan race. And to help athletes and to to relax from the intense race, the race they have been taken, because a lot of them that having cramping and or having any kind of like a pain, due to the obstacles that they have been taken. And also, this is the one that some of the herbs, it's not really, I don't want it to bring it kind of people sounds like it's taking drugs or something like that.
Right.
Herbs that actually some of them has the potential to help the body to kind of like hold the oxygen and to be able to get through in this kind of like a little bit out of balance situation, because when you're doing race and you're running, your body is in the intense situation that lacking enough of oxygen required by your whole system. So in this kind of case, some of the herbs, such as like with the Tibetan rhodiola, this is the one that has been used, for example, people who travel to Tibet or Peru in the very high altitude area when the air is very thin, that the body also in the situation that need a lot of oxygen to support. And that's very similar like when we are running long distance and doing intense exercise. And so these are the herbs that can be giving a good support. And they're the one that's different from those kind of like illegal drug using that have been used in the competition, because they are not going to mess up with your system in the bring people in the hyper situation. So it's pretty safe at the same time give support for exercising or in competition or race.
Dr. Luo, what about with acupuncture? I know that people have talked a lot about how much it can help with recovering from injuries that you might have sustained in athletics.
Just now ask about athletes. I could give an example. Okay, this is not really athlete, but significantly improve the moving function. We have the patients in the hospital, that is around 70 years old, male. One of the concerns, he cannot really walk energetically. He's actually very tired. He wants to walk, but cannot walk too much. So we use the points just now mentioned, the 3 miles below the kneecap anterior. They call stem 36. We use moxa, use needling for 1 month. What happened to that gentleman? Actually, he started to use his cane walking early morning during our morning run everywhere. Bom, 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 bom. During the morning run, actually, it's very quiet. Only doctor and nurses talking. So all the patients are very quiet. But this grandpa, patients already started working everywhere. So you could see through stimulate the stem 36, how much energy, how much muscle strength it could improve. This is very, very practical. Everybody, if you come here for 1 month treatment, you don't have to wait that long. You already could see significant difference. This is true. Just now I haven't mentioned actually my specialty is in neurology. I treat many stroke and muscle strains, weakness, these kind of patients. Acupuncture could significantly improve the muscle strains. Some patients we have treating in St. David's or in Sydney, some very early, only 1 week, 2 weeks, we started treatment. Actually, you will see muscle strength improve a lot. They could help you walking, help exercise. And also I treating the patients in ICU in China in the hospital. Okay, that means the patient only has a stroke, cannot walking, cannot talking for 2 hours, for example. We started as needling. But later they do research, they'll see they could improve the muscle strength during the recovery because you start doing acupuncture treatment early. They could put up your Wei Qi or immune system stronger at that time. This is pretty fast. Here in the United States, we're treating quite a few rehab stage stroke patients. Also, we have has more and more very acute stage, only has 1 week, 10 days stroke patients. They could see significant muscle strength improvement. Even some patients, they come here already too late, for example, 1 year, acupuncture still could stimulate several points to help the muscle strength. Athletes definitely will benefit from that. You could see,
When you mention those specific examples like that, what is it like for you to see improvement in somebody that's suffering like that and to see it so quickly? That's got to be both for you and for the patient, I would think just incredibly gratifying.
Yeah, exactly. This is one of the big reasons I love this job. This job is not only to treat patients, actually you could change the patient's life. You could change the patient's family member. Yeah, they don't have to take care of this patient anymore. They don't have to sit in the wheelchair anymore. So they could sometimes self-dependent by themselves. Yeah, especially you see the stroke patients. Yeah, we have just like example, we treating the stroke patients. After that patient recovered, okay, pretty well. So one day, my family actually, my dad go to buy some dumpling, Chinese dumpling, just like some flour food for the New Year in the store. That patient, we don't know why, he haven't met my father before, but then maybe he say, looks like me. He said, are you the father of the Dr. Luo? He said, how do you know? Okay. Well, finally he said, I don't want to take your money. I don't charge you money. So you just take it away. My father said, no. We have to take your money. Patients really give their gratitude and thanks to you. This is very good energy. So more patients will come here. Actually, more patients will benefit from. Right now, a lot of stroke patients in this country, they go to, I know, for example, St. David's, they have a very good rehab program for the swimming pool or different things. But just like see, if you have acupuncture involved, it will feel patient will recover even faster. Yeah, they will help patients, they help the physical therapist, they help the neurologist, because they will notice the patient improve faster. Yeah.
Well, that leads me kind of to something I wanted to ask both of you. I think for a lot of us, growing up in the United States, we're so used to Western medicine and that kind of as being the only answer. Can it be a challenge to get people to be willing to be, I don't know if open-minded is the right word, but to look at something different that can really help them? And how do you kind of break through that messaging to people?
This is a very, very complicated question. Thank you for asking. If you want to break through this, actually, you have to know both of these, simply speaking. Yeah, you have to know traditional Chinese medicine, acupuncture, and also you try to know something about biomedicine, because most people in this country, they know biomedicine very well. They get education from their elementary school just like this. This is the reason, Dr. Song was, I already passed all the physician exam in the United States. So that's why, because you know mechanism in biomedicine, then when you go to, for example, we go to Round Rock, the Satan Hospital, you explain to all the physicians, you use which familiar way you find the similarity from these two systems. Then you met the doctor, you explain in biomedicine, then explain the Chinese medicine. If you met the patients, if they know biomedicine, I will use biomedicine methods to explain everything to them. If they don't know biomedicine too much, I will know Chinese medicine to explain how about the qi, how about energy. You have to know both, generally speaking. This is the simplest.
Yeah. Sure. What about for you, Dr. Song? Do you find kind of a similar experience?
Yes, I would say that actually biomedicine-based practice and acupuncture or Chinese medicine practice, and they are not enemies. They should be friends. It's just like we're through different angle or different lens to looking at the patient. It's the same patient, it's the same disease. It's just like we are using different methods to analyze. For example, I usually mention that in Chinese medicine practice, we call it the Christmas gift theory. So in biomedicine, we need to do blood work. We need to kind of surgery, open it and see if we see the tumor, if we see any kind of like marker changing. But in Chinese medicine, it's that we are not going to kind of like draw the blood or kind of like doing any kind of anatomy-based practice. But it's like when you get the Christmas gift, when we look at it, we first see, oh, that's huge, or it's small. We have an idea is that it may kind of fall into what category. And then we're taking the gift and shaking and listen. Is it going to create some sound, or it's the one that actually not quiet? And then we're going to squeeze it. Is it soft or is it hard? That's the one that we're doing practice in Chinese medicine, that we're going to asking patient questions about everything about your house bowel movement, house sleep, house stress. And that's the one that we are doing the Christmas gift analyzed and to see what is really happening inside. And then from the treatment wise, that it's just like differently. So for example, if we're seeing the cases, it's like a fish in the fish tank, and this fish is sick. So biomedicine would say that I want to take the fish out, look at if any bacteria or fungus or any virus. And then from the Chinese medicine, we were going to see, is the water in the fish tank is a little bit color changing? How's the pH in the water? And then we're trying to kind of treat the water and then let the fish be able to have a healthy environment. Maybe the disease would be resolved. So that's just like through different angle or different aspect to kind of approach. And the main purpose is to serve the patient, to help them reach back to healthy, balanced states.
I love both of those analogies. It makes it easy to understand and to kind of visualize. For both of you, how important is this from a preventative standpoint? In other words, like before somebody's sick, to consider acupuncture or to consider herbal treatment and how that can help them? How important is the preventative side of it, Dr. Song?
Yes, prevention actually is a very big concept that has been used in Chinese medicine. So that's why a lot of patients who come to our clinic, they may not get exact diagnosed yet. And we even sometimes call them subclinical situation, but we prevent them to get into disease status or having any kind of like a severe situation. So prevention is very important. And as when we were students in acupuncture school, we usually would say that a good doctor is like a good king. They need to managing their country and make sure that everything would be okay to prevent any chaos happen. So you have to make sure that everything is balanced and peaceful. And it's like our body. We need to maintain our body having balance and healthy, and to prevent disease situation. And like a country to prevent it getting into chaos.
Sure. Yeah. I mean, Dr. Luo, I consider myself to be relatively healthy, but I'm a runner. Would there be a benefit to me to look at acupuncture, even though I don't necessarily feel like something's wrong?
Mm-hmm. I think so. Acupuncture just like similar like the Chinese herbal has very strong policy about the prevention. For example, if some people regular exercise but worry about the could be attacked by any disease, they still could stimulate the stomach 36 on the leg to help you put up the qi to defend yourself. And some other disease the same. For example, people has asthma. Usually asthma attack in winter. So in its medicine culture, they have a long history to prevent that. Start from summer, start to have moxa or has acupuncture treatment in order to prevent the winter disease. Same things right now, the coronavirus. We don't think it's good only start the treatment after it got sick. We do have some patients got sick, then we give herbal. But herbal, we could use different dosage, different ingredients. That could be modified for some people who haven't got sick yet. So actually, this could either decrease the chance to get sick, or if you got sick right now, could make your symptoms milder, not develop to a very severe condition. This is a very important idea. Yeah, this is why we try to post many formula for coronavirus very early. A couple of months ago, maybe in January, we started to post on some social media area in order to help more people. Yeah, and that is, of course, in TCM, just like Dr. Song said, each patient has its own different environment. We need to evaluate individually. But we sometimes in some urgent condition, we could try to find some very basic acupuncture formula or herbal formula to help them. And then if you have a chance to individually serve them, that'd be great. Yeah, but we try to make the large population be benefit first.
Well, this has been great. So informative, so interesting. What's the best way for people to find out more about each of you and what you're doing? What's the best place for people to go?
I think in Dr. Song and I both in AOMA clinic. We have a North clinic and a South clinic. And right now we give just the telehealth. We give the virtual clinic. Usually from Monday to Friday, I think is We have some, except from class, we have some teaching students, supervised clinic. You just call our North Clinic and South Clinic. They will find our schedule and to help some patients. Yeah.
Okay. Well, thank you both so much for making time for us. Really was incredibly interesting to hear, and I hope it helps some people.
Yeah. Thank you, Ricky.
Okay. Thank you. And thank you for joining us for Austin Fit Talks. If you've missed any of our episodes, you can check them all out at austinfitmagazine.com.